Hi, this is Dr. Steve Henao from Albuquerque, New Mexico, vascular surgery at the Heart Hospital in New Mexico. And I'll be sharing with you the latest information that we have on the Eluvia drug-eluting stent. First off, I'd like to thank Dr. Walker for the privilege of presenting this information to you all today. Now, we know that Eluvia is certainly a game-changing product in many different ways, and we'll kind of review some of this here with the idea of the design, specifically polymer actually being embedded onto the stent, and the way that the paclitaxel is situated within that compound allows for a diffusion gradient through calcium and through fibrotic tissue and through plaque, so that it seems to be extremely efficient and effective in the way that it's able to prevent reaccumulation of plaque. With the highly sensitive nature of paclitaxel in the current climate, although we don't have specific data to say that there's a dose response curve to some of the things that may be leading to the signal for mortality, it's still important for us to recognize that this is the lowest drug dose concentration on any drug-eluting technology, especially when you compare it to a number of the other technologies, such as drug-coated balloons, which have quite a significantly higher amount of paclitaxel in impacts. Example, 20 times less drug concentration on that device. And we know that with the IMPERIAL head-to-head study versus Silver PTX, it's demonstrated the highest 2-year primary patency rate. And even more significant, the lower target lesion revascularization percentage, which we'll go over specifically in the next few slides. When we look at the specific design, the dual layer allows for bonding of the paclitaxel layer onto the metallic struts of the Innova-based stent platform. Again, talking about the small amount of drug actually on this device, 0.167 micrograms per millimeter squared surface area. And even more compelling is the way that the polymer itself, which was derived from the Promus coronary stent platform, but tuned specifically for the periphery so that the elution of the drug takes place over well over a year's time. And the original 1-year data from IMPERIAL and Majestic demonstrated excellent results. When we look at the way that it differs from all the other drug-eluting technologies, we know that this is actually the only drug-eluting stent. This tends to be a misnomer in the periphery when talking about Silver PTX, which is not an eluting stent per se. And again, having a lower dose of paclitaxel when compared to all the other particular technologies. The other concern, especially with our critical limb ischemia patients, is the potential for downstream particulates. Drug-coated balloons, we know, cause this, and the Zilver PTX causes this as well. But when it was studied on the Eluvia platform, it really did not generate any significant particulate debris than a plain bare metal stent, as you can see here, where you're talking about hundreds of particulate counts, and then in the tens and hundreds of thousands in the case of the Silver PTX stent and the impact balloon, respectively. So where does this all go? What are we getting to? Well, I think we are very curious to find that the clinical results certainly seem to translate from the bench testing for this particular device, looking at the original 12-month Kaplan-Meier estimate for primary patency. In the randomized control trial at 12 months, 92.1% primary patency. And now at 2 years, 83%. Now there were subset analyses within the IMPERIAL looking at long lesions, and this also demonstrated impressive 77.2% 2-year primary patency rate. Majestic, the Munster Registry, the Auckland All-Comers Registry, and DES Henao demonstrated significant patency rates at 1 year, with lesion lengths specifically in the Munster at 2 years that didn't have documented statistical numbers. The CTOs, which I'll go over in some of these later slides, will also demonstrate a robust patency rate as well. Looking at the Kaplan-Meier breakout here, looking at the comparison with Zilver PTX as well at 24 months, 83% with the Eluvia, 77.1% with the Zilver PTX. When we look at the breakout here, comparing drug-coated balloon therapies as well, you can see compared to the control groups, which are largely plain old balloon angioplasty, the numbers for primary patency at 2 years hover around the high 50% rates to the high 70% ranges. Again, when we talk about paclitaxel, it's extremely important for us to be looking at mortality, and 24-month all-cause mortality was essentially no different in both drug-eluting stents. The Zilver PTX and the Eluvia demonstrated no statistically significant events at 1 month. Target limb major amputations were also not statistically significant. Where we do see a move here in the numbers is in the clinically driven TLR, 12.7% with the Eluvia compared to 20.1% with the Zilver PTX. Other major adverse events such as stent thrombosis also appear to be non-statistically significant. So we see that, again, there does not appear to be, in this data set, a signal for mortality or morbidity, which is extremely compelling. The target lesion revascularization, as I mentioned earlier, is significantly reduced in the Eluvia versus the Zilver PTX at 12.7 versus 20.1%. And you can see this as we look at the subgroups, moderate and severe calcification, diabetes, and the CTO subgroup also demonstrated excellent results regarding reinterventions. And we can compare this to the standard numbers for PTA at 38.5% and bare metal stents at 25.8%. The mortality rate, once again, looking at a 6.5% at the Eluvia, looking at both Majestic and IMPERIAL compared to symptomatic patients at 5 to 11%. This really is a range that you would not expect to be much different in our standard peripheral arterial disease patients. So when we look at the IMPERIAL clinical study overview, the study design was a 2-to-1 randomized for Eluvia versus Zilver PTX. And it was initially powered to show non-inferiority. The long lesion sub-study was a single-arm study looking at lesions that range from 140 millimeters to 190 millimeters. The head-to-head trial was a total of 465 patients, and the long lesion sub-study involved 50 patients. There was also a sub-study looking at the pharmacokinetics. This was a small study with 13 patients looking at the quantification of paclitaxel 30 minutes post-implantation, and demonstrated no mortality at 1 year. So through 24 months, there's a significantly lower clinically driven TLR rate for Eluvia versus Ilva-PTX at 12.7% versus 20.1%. And again, we see sustained primary patency rates up to 2 years here with an 83% Kaplan-Meier estimate, regardless of lesion or patient complexity, which I'll touch on a bit more in the coming slides, but also compelling that there was a low mortality rate at 2 years. So looking at CTOs and non-CTOs, diabetics and non-diabetics, and patients with complex plaque morphologies with mild versus moderate to severe calcification, there was high patency rates for all of these patients. So essentially saying, even with the real world, very difficult patient populations that we see on a daily basis, the Eluvia stent appears to perform extremely well, regardless of the lesion or the patient complexity. Touching on safety again at 24 months for these challenging patient subsets, you can see that the clinically driven TLR demonstrates excellent performance in calcification. There was no difference in whether a patient was diabetic or not. And there was no statistically significant difference in whether or not a CTO was encountered during the intervention as well. Going a little bit deeper here at the 2-month or 24-month results for diabetics, you can see again that the Eluvia at 13% TLR versus Ilva-PTX at 23.6%, while not being statistically significant, is a comparing or a compelling number to recognize here. So at the end of 2 years, there's a significantly lower clinically driven TLR rate for Eluvia versus Ilva-PTX at 12.7% versus 20.1%. Excellent primary patency rates are sustained with the Eluvia drug-eluting stent at 83%. And again, regardless of the lesion or patient complexity, high patency rates are noted for these patients, again, with a low mortality rate at 24 months. Again, I sincerely appreciate the opportunity to present this clinical data regarding the Eluvia drug-eluting stent to you today. Thank you.